My name is Mark Rausch. I am a board certified residency trained emergency medicine physician working in emergency departments in Richmond, Virginia. Continuous blood pressure monitoring is important in the ER, not just for the physicians, but also for the staff, for our nurses. It's great for limiting spot checks, as you are always having to go into the room potentially every 15 minutes to recheck the blood pressure cuff. You could see it real time, while working at your workstation, which has been phenomenal for our RNs. You really are, catching blind spots, again, with people who are critically ill. You wonder about what their blood pressure is in between these spot checks, and your spot checks every 15 minutes or 20 minutes. And, one reading is bad because their arm might have been bent, or they might have been hanging their arm off the side of the bed. You're going to get an abnormal reading. And again, it could be another 15 minutes till you get an adequate reading. And with the Caretaker Medical, you're going to get those absolutely, continuous readings right in front of you while you're working. It gives you better data, better insight to where your patients are trending, especially when providing them with some therapeutics and seeing how they're responding to them, specifically IV fluids, pressure agents, antibiotics, and so forth. And then really the collaboration with the early warning system, which is allowing us to truly see where patients are trending before they're going to go and deteriorate more quickly than what we've seen in our past, working with just a typical monitoring system. There are definitely patients that are going to be most beneficial in having the Caretaker 5 monitoring device. Clearly, sepsis is a big focus now in the emergency department, and the sepsis campaigns that are going on. And so really with sepsis, you're going to see real-time readings of their blood pressure and responses, again, to therapeutics, how they're responding to IV fluids, large boluses of IV fluids, and is their blood pressure responding, which is a key marker to seeing improvement with septic patients. You're also going to see it with cardiac patients really well. Those who are deteriorating from any sort of cardiogenic shock, heart attacks and so forth, congestive heart failure, as you're trying to get fluid off and diurese these patients. Are they responding, and how their blood pressure is trending? So not just for physicians, but clearly the ER staff benefit from the Caretaker 5 device. What you're finding is that the remote workstation is fantastic in that you're going ahead and seeing real-time monitoring of their blood pressure and their other various vital signs. It is great for data collection, and it integrates well with EMR systems. So you're going to have quite a bit of information for the EMR and the data that's being supplied. And then what I really do like about it is that as a wireless device, when you're having critically ill patients, they already have enough wires and tubes attached to them. And so, transporting patients through the emergency department to, let's say, radiology for diagnostic imaging, such as a CAT scan, for the staff, all the way down to the paramedics and the RNs, to transport a patient to have less cumbersome wiring really helps as well, and makes it for a more efficient transfer of the patient, as they go from into radiology or some sort of diagnostic imaging.